And the American Academy of Pediatrics is tracking how this virus is affecting children. Here's what they found. As of August the 5th, there have been nearly 4.3 million total coronavirus cases in U.S. children. Now, that week alone, there were more than 93,000 new cases in children. Child cases steadily increased from July into August, but children were really only a tiny percentage of the fatalities in the U.S. Dr. Jayne Morgan is the Executive Director of the Piedmont Healthcare COVID Task Force. She joins me now from Atlanta. Doctor, great to have you on the show. Thank you so much for joining us. Certainly really worrying numbers when it comes to children.
Yeah, absolutely. Thank you for having me on, Robyn. And certainly as we move through with this Delta variant, this fourth surge, we see that the impact is greatest on younger and younger demographics. And this is not only because of the virulence of the Delta variant, but it's also because of our successful campaign to get those over 65 years of age vaccinated. And so now the virus is finding its opportunities on our children.
And why are we seeing particularly children, young children, not just youth, but young kids being very, very sick in the hospitals? We had one report of hospitals warning that if your child was in a car accident, for example, or had a health issue, that they would have to wait for another child to die before an ICU bed would become available. That's just one example of one hospital. But why are we seeing so many children being so sick this time around?
Right, this is such a tragedy. When we look at this particular variant, we have to remember that it's 1,200 times as high, meaning the viral load is that much higher than previous variants, which means it's that much more contagious and probably confers a much more serious course, increasing in hospitalizations, because that viral load really determines what type of severity of disease that you're going to have. One of the reasons that we're concerned about children in car accidents or other people who need treatment in hospitals that are non-COVID related is that our hospitals are beginning to fill up with these COVID patients. So people who need standard medical care or emergency medical care in hospitals are having a difficult time or are at risk because there is no capacity.
What is your expectation then when this can ease? And are you waiting then for a vaccine, particularly for the under 12s? And how much is going back to school this week or in the next few weeks and fall going to intensify this crisis that you're seeing, particularly with children?
You know, Robyn, those are such good questions. We just came out of our hottest month ever, the month of July, and we saw this variant really take hold. And this is a virus that really proliferates and really thrives in cooler weather. And yet here we are, the hottest month ever recorded, and the Delta variant took hold. So we are really holding our breath for the fall and for the winter. We are starting to see signs maybe that it may begin to burn out in the next few weeks, but those few weeks are going to be quite treacherous as we move forward. Vaccines for children, I do not anticipate will be available in the next few weeks. In fact, for both Moderna and Pfizer, the FDA has asked them to expand the number of children in their clinical trials. We want to see more robust data, which will then continue to delay the time at which we will get full FDA approval here. And so we may not see vaccines for children under the age of 12 until late into winter, unfortunately.
We're also seeing a number of reports of long COVID, of long-term effects, disability in many children as they try and recover from this. How is that also impacting the lives of so many people and children?
And we certainly don't know what the impact of long haul will be on children. All of the long haul data that we have to date that's fairly robust and reproducible has been in adults. So that is an unknown, but probably children, unfortunately, if they're infected with COVID, even if they are asymptomatic or have mild disease, could risk this long haul syndrome, where they could actually have worse symptoms months down the road and struggle with it for a long period of time. And so we want to encourage everyone who is around children to be vaccinated, because we are depending on you to protect those who are unable to be vaccinated. And in this case, it is our children.
Dr. Jayne Morgan, thank you very much for your very sound medical advice, your analysis, and also all the work that I know that you are doing. You're the Executive Director of the Piedmont Healthcare COVID Task Force. I'm going to let you go. Thank you very much.
Thank you, Robyn. I appreciate it.